Hello, I'm Jawad. I'm the Exec Medical Director at East Lancs NHS Trust. Just a very brief outline of what's happening in regards to COVID. It is unfortunately still very prevalent out in the communities. The numbers just don't seem to be taking a dip as we would have liked to. And unfortunately, that is reflecting in the number of admissions that are currently ongoing, whether it's to critical care or to our general and acute bed. Despite all the measures we have taken, there still is going to be a number of patients who will get affected by COVID and may require admission. This is on the top of what we already look after in the virtual COVID ward, which are the patients who are in the community but supported by our primary and secondary care team. I'm not going to go through the numbers, but I'll focus on some of the relevant issues that is pertinent to current situation and what NHS and its staff is currently facing. Firstly, as I've mentioned previously, there is a significant increase in the number of attendances to A&E. Not all these attendances clearly require admission or at times even any intervention, meaning by that we are very much looking for our population to first consult their GPs, the primary care facilities, pharmacists, and all that is out there in the community before they think of heading towards accident and emergencies and urgent care. And if you do require that care, then surely we will be able to offer you. But please explore all the other options before you head towards A&E. Now, having said that, it is important that whilst we are kind to our patients and we look after them, we would very much want that reciprocated. It does seem in the recent past that people are losing that tolerance, and there has been incidents of aggressiveness towards the NHS staff. This is not what we are, and this is what we don't want to see. Be kind to the staff who is looking after you. Be patient with them. Everybody who comes to work with the passion that they want to serve their patients, and we would very much expect that people who attend, whether it's patients or their families, they reciprocate the kindness to the staff in NHS. It is important that whilst the patient needs to be in the hospital, we look after them, but we also ensure that they don't necessarily stay any longer than they should. Our request to the families is have a forward think of where would you next like to see your loved one move to. Home is the best place, and that's what we all aim towards getting the patients. But at times there needs to be some step down intermediate facilities that the patient requires. So please work with the staff in the hospital to input into the discharge planning. It is very essential to keep the flows going so that the patients are in the right place at the time where they need treatment, but then moving on ultimately towards their home. Now, winter has almost set us on us, and we have to be very careful, and that care relates to how we look after each other and ourselves, especially in relation to alcohol intake and the alcohol related injuries, and even being safe while driving on the road. So please be sensible. Seek some help and guidance if you feel you are under pressure and you need help in relation to alcohol or its related substances. Finally, we have been talking about protecting yourself from all sorts of infection, just not COVID, but flu. So the campaign nationally and locally is very much ongoing. If you have been offered the flu vaccine, please do take it up. It is essential that you protect yourself, but you also protect your loved ones by preventing the transmission of infection. Similarly, in relation to COVID, do take up the vaccine, whether it's the first, second, or now the third booster dose as it is being offered. And again, being winter, do protect yourself from cold, because there are in winters increased incidence of admissions due to chest infections and all the related effects that winter can have. So on that note, I'll end my update. I'll see you in a couple of weeks' time with further that is ongoing in the healthcare system and out in the community. Bye for now.